You're calling these changes as a result of an overspend. Or is this more of a case of underinvestment or underfunding?
No, what I want to say to everybody is, health today in New Zealand, we spend about $30 billion every.
So this is the answer where his response is, are you underfunding it? No, because we've never spent more. Okay, that doesn't mean it's not being underfunded. If I've got a mortgage and my mortgage is $1,000 a week, and last year I was paying $700 a week, and now I'm paying $800 a week, I've never paid more towards my mortgage, but we're still going backwards $200 a week. That's not an answer to is it underfunded, but it's the answer that he's going to give.
Say to everybody is, health today in New Zealand, we spend about $30 billion every year on healthcare. And in addition, in the budget, as we've talked before, we put in an extra $16.7 billion over the next 4 years. So we've got record amounts of money going into health. And I want to make sure that as I put taxpayers' money into healthcare, I'm actually putting it into a really high quality organisation that's going to deliver the outcomes that I'm expecting to get for that money.
Yeah, and that'll take time.
Well, that's why we put a commissioner in, so they can move with great speed.
Yep.
Again, there's a lot of focus on speed. That doesn't also necessitate, doing the job well. Most of the times when we want a job done well, we don't move with huge amounts of speed. These guys are talking about, and every answer they give, not necessarily in this conversation, it's always about hitting budgets and doing it quickly. They very rarely talk about doing it properly, no matter how long it takes. And I mean, we were talking last night, Chewy, and I was listening back to a clip today because I was editing it, and you said something about the American election, that it'd be nice to have a nice boring, series of politicians in just to run the country. It's like, yeah, boring politicians will do things right, even if it takes a long amount of time. These guys are about moving fast and hitting budgets and slash and burn. So again, what he just said, a commissioner in place to move quickly. Why? Do it well. Measure twice, cut once. These guys aren't measuring at all, and they're cutting straight away, Chewy.
It's move fast and break things.
Yeah,
which is a great analogy if you're talking about the corporate world and agile and all of that sort of stuff. It's less good when you're talking about people's health care.
Yeah.
And I think that, again, it comes back to that whole thing of like, equal care, everybody gets treated the same, that sort of thing. We know it's not going to work.
Yeah.
It's exactly right. You're spending a whole bunch of money, but what are we getting for the money? And the question that should go along with this, with his backhanded fucking comment about, I want to make sure it's going into a top organization, as if Health NZ is not a top organization. The Te Whāra Ora is this rickety shambles of bloated government spending, which it isn't. It just isn't.
Yeah.
Our population's expanding. If it was bloated, that we'd have nurses standing around scratching their bums because they had nothing to do.
Yep.
The doctor's car park full of Bugattis. We don't have that. And if his answer is to run this down and privatize it, like I think they want to, because the health minister is involved in private healthcare, the guy that they've just appointed is a huge fan of private healthcare, and these guys have been reading the Tories' notes as they dismantled the NHS and made it an ineffective shell of what it once was. And these guys think that's a great idea.
Yes, indeed. All right, we'll keep going.
Yeah, and that'll take
time.
Well,
that's why we put a commissioner in, so they can move with great speed.
Yep. So, in saying that, though, Health New Zealand was already taking measures to limit spending, right? Public hospitals were told to cut back at around about $105 million by July. That included roles not being filled. Is that not a sign of underfunding?
No, I disagree, Jenny May. Just so you're really clear, the funding is record levels. We've never had this amount of investment in health.
This is the talking point, right? PR agency has got them to say, just remind them how much we're spending. That's all you got to say. Remind them how much you're spending. Jenny May has another question. Yeah, answer big number.
May, just so you're really clear, the funding is record levels. We've never had this amount of investment in health in New Zealand.
And last year's funding was record levels, and the year before that was record levels, and next year is going to be record levels because it goes up every year.
ever. And we were able to do that by making savings across public services in the budget. The second thing I'd say to you is we've got a massive focus and a drive on recruiting frontline staff. And what this is about is saying, look, there's 2,500 extra managers that have been put into Health New Zealand. There is 14 layers of management between the patient and the CEO. If you're a frontline doctor or nurse, go talk to them and talk about the challenges that they've got dealing with management mush that sits above them. And so this is what this is about, is making sure that organisations set for...
I get a feeling that was brainstormed as well. Management mush. Mark this one, management mush. See how much you hear that this week.
Purpose. It's focused on the front line. It's focused on those outcomes. We now have 2,900 extra nurses in the healthcare system.
Oh, when did they go through the education sector, I wonder? I wonder who they graduated under, because there's an extra 2,900 this year. Wonder when do they start doing it with a free first year of education? I wonder when. I wonder if these guys will take credit for them.
Over the last year, a lot of that's come through in the last 6 months under our government. We've got more nurses in our system than we've ever had before. Yes, there's now more nurses needed in mental health, critical care in some of the regions, and that will continue.
No, that's it. We're cutting through it because that's the BS level. See, we have to come out every couple of minutes to get rid of the BS. Got to shake it out of the sides of your head.
Jesus.
That's fantastic. That it's like 2,900 extra nurses, many of which came through in the last 6 months. Yeah, but it's a 3-year course, numbnuts. When do you think they were studying? Not under you. You're taking credit for Labour's advancement of nurses. Good on you. All right, Chewy, you want to get in there? We've got a couple more to play.